Welcome, everybody. I'm the president of GuidedSMILE, and I've been running this company, this company for about a little over 2 years now. I was embedded in a laboratory for about 20 years, and then we moved out, and our only customer now is dental laboratories. So we work with a network of labs all around the country. We have a lot of fun doing it. We have a big team, about 35 people. And all we do all day and night is make surgical guides for doctors by way of dental laboratories. And I suggested this topic because it has become kind of near and dear to my heart as we focus a lot on full arch cases. That is our primary product. And we make all types of guides, every kind of guide that you'd ever need for placing an implant, period. But our primary product, our flagship, is Chrome GuidedSMILE. And what we found over the years is that a lot of these cases, some of them that we do, and obviously some that don't go through us, need what's called revision. And I'm going to talk about that today, almost exclusively about these revision cases. And I'll define that in just a minute. But here's the agenda. I discuss and define revision. I'm going to spend some time on these challenging cases that we worked through and go through how we overcame the challenges of these patients with existing full arch implants and prosthetics. Review fixed and removable cases. I'm going to talk a little bit about the records, and I can share checklists with them, anybody who's interested, and then just a little bit of statistics. And what is fascinating is the quantity of full arch cases in America. And I have a pretty good source that in last year, the calendar year, there were about 100,000 full arch cases completed. And that's fixed, removable. That is specialties, private practice. TSP is total service provider, like super GPs. A lot of it's corporate, as you can see, about 60%. And then, of course, a lot of them come from dental tourism, too. So that raises that number. We see a lot of cases coming from overseas. And so that number is going to be off a little bit because that number is based on multi-unit abutment purchases in America. And that number is going to be higher because there are systems out there that don't use multi-unit abutments, right? So it just keeps ticking up a little bit more. And what percentage of these cases over the years need retreated? That's the main subject of tonight. I mean, just how many are we going to be expecting over the years? And I have a graph coming up where I make some predictions based on historical numbers. And what is the life expectancy of these cases? Traditional hybrids with titanium bars, 12 to 15 years. That's what we used to be told. That seems to be about right, unless somebody's really abusing it. Zirconia, I don't think we really know yet. We're only about really 10 years into solid full arch zirconia. Yes, before that, but really transitioning over. And I think they're going to last longer. Certainly the materials will, but what happens to the case, to the implants, to the bone? Still a little bit of science left to be studied on that. And then these full arch centers are popping up all over the country, right? So many, there are so many of these full arch, same day, next day, that we know the numbers are just going to keep going up. And I put this image on the bottom. This is an email and an image that I received this morning. I get these just about every day. Hey, I have this case. What do I do with it? And we want to help because we know that now and in our recent past, which is 30 years of doing full arch cases, look how these numbers are going up. And again, some of this is estimated based on where we are now, 100,000 a year, with a 7, 8, maybe 9% growth now. But look where these numbers go in the next 20 or 30 years. And who's going to be restoring these? Maybe you, maybe another generation in 20 years. But there has to be a system in place for accepting these patients because they're not straightforward at all. And And as you'll see as we go through these cases, there's lots and lots of challenges with restoring these cases. So what's a revision case? It's a patient, it's a person who has existing implants. So that's a starting point for everyone. They have implants, they have existing fixed or removable prosthetics, and there is either an event or wear and tear, poor planning on the original version. Something is going on where this patient now needs more implants, more componentry, maybe just a new prosthesis, retread, or a whole new prosthesis for some reason. But they usually need more implants and they usually need more teeth. That's what you'll see here, especially tonight in this program. And this program is about guided surgery protocols, right? Not freehanding. That's a whole different avenue. This is about how to set a case up for planning a case, and also digital and analog workflows. You know, if you're a fully digital office, you plug this right into it. If you're an analog office, or if this is a redo of some records that you already have, maybe it's more of an analog process. That's okay. But putting the implants in and planning these cases is a digital workflow. That's what we're going to talk about today. And I want to spend a little bit here. This is really special thanks to Dr. Castedo and his team. All these cases that I'm going to show tonight are with his team. And we have completed many, many, many cases. About 90 cases, and about 60 of those are revisions just in the past 8 months, just because of the zip code that he's in. And he is dealing with, some catastrophes and just some wear and tear and retreatment. We'll go through a bunch of them. And thanks a lot for his team, too. His team is awesome. Savannah, Christina, David, Sandy, Teresa, Lillian, Amanda. The last two are my team here at GuidedSMILE. And Sandy is the Nobel rep. These are all NobelSMILE voucher cases. That's our big partnership we have with Nobel Bowel Care. And then Savannah and Christina are his assistants. David, Teresa run the show. So thank you very much to them. They just do some great documentation that made it possible for us to go through these cases and share what we've done. So I'm gonna just quickly go through a whole bunch of pictures to show you what this is about. All right, so this is a fixed revision case, bone loss, prosthetic, obviously an older prosthesis, traditional methods, but it's time, and it's going to be time for all these to have a revision. This would be placement in poor areas and bone loss for a health problem, but cases like this are just almost impossible to restore. And I say that after 24 years of doing these. Yes, we could sit here on this screen and talk for an hour about what to do with this case. I get it. Okay, there are many avenues, but the cases that I'm going to show tonight are the ones that we've worked up together, Dr. Castedo and my team, and we've worked them up and we've gone a certain avenue, and I'm going to go over how we treat them, even though there are 10, 20 different avenues to take to restore these cases. So these type of cases, implants too small, bone loss, just issues, prosthetic space. These are the kind of cases that walk in his zip code every day. And there are really no other doctors in town to treat them. No offense to any other doctors in town. It's just in this particular town, there aren't many, if any, full arch doctors who can take on these types of cases. So I don't need to go, I don't really need to speak too much about these. You see these and you say, yeah, okay, yeah, it's time. It's time to do something for these cases. Too small of implants, the patient wants a lower fixed prosthesis, the upper, there's just not enough implant there to support a fixed prosthesis, and patients made a decision, and we're going to go that route. This is upper denture not fitting well, lower natural teeth. And what I'm going to do is I'm going to show you a photo and then the pre and the post. And I'll just keep going through these, and then we'll get into some real, the meat of it and the details here in just a minute. So, and I see some chats. Please do post questions, anything. open book. Whatever you'd like to ask, I will try to answer at the end. All right. So I have some notes on the right, but I wanted to shrink them because I accidentally kept track of all the patient names in here for myself, just so I would know as I'm putting these together. It's If you've put together a PowerPoint, you'll know that it's about 40 hours per hour. So it's tough to keep track of all these slides. So, we're going to go through this case. This was a nice one, real nice. And it was time for him. He was in a removable and then he went to fixed, natural teeth fixed. You see this? Revision, lower denture, upper fixed. But it's the revision part. These patients walked in with implants. And maybe it's a freehand situation for a lot of doctors, but as you go through these slides and you see the types of cases and you see the symmetry that Dr. Castedo introduced into these implants, the left and right, the balance, you'll see a lot of pterygoids. You'll see a lot of, maybe you'd say it's over engineering, but he wanted molars. He wanted the patient to have good, solid function. So we added a lot of implants. And you can imagine the longevity of a case like this, right? Because of the number of implants, the balance of the implants, the structure, the engineering that went into it. So I hope I'm not boring you, but I just want to take you through all these cases, and he documents them marvelously. All right. So again, I'm just going to go through a few more, and you can see the amount of work that goes into these cases. And again, the symmetry, the structure, the engineering. Okay. So boom, there it is. What he and I and our team have tried to do is move away from this. Patient has implants. You take an implant or multi-unit abutment level impression and you make a model, then you scan it, then you bring it into the CT and the plan and the intraoral scans or whatever it is, and you try to align all these things and then try to make an accurate guide. It is tedious, very tedious, and it's a soft tissue impression, so it's going to be tough to make a surgical guide fit this intimately, perfectly, to line up implants between other implants, to put in pterygoids from a surgical guide. All right, so we need precision. So we're going to move away from that type of case that we did for years, even up until last year. And we're going to go more of a digital precise route.